on the diagnostic side, what are the diagnostic criteria and imaging modalities that you consider most reliable in identifying spondyloarthritis early, especially in non-radiographic disease?
So I think really taking a careful history about the pain and stiffness and what makes it better is probably the most important thing. We do have diagnostic criteria for this, but this is still largely a clinical disease. Blood work can be helpful. So if someone is HLA-B27 positive, that can be helpful, but I find a lot of people are not. Um, looking at levels of inflammation, so a CRP and a SED rate can also be helpful, but certainly a lot of people with very active disease do not elicit those types of responses. And again, this, often I find backfires in clinical practice because those people may be told that nothing is wrong with them. And it's really just that the parts of the immune system that are involved here don't elicit a SED rate or a CRP. So I think it's useful to look, but it's not useful to rely on those. I would say that when those are present, those do portend a more aggressive disease course, a higher likelihood of joint fusion, and they also actually predict a better response to medication.
Mm.
But I think doing a good history and a good clinical exam is really still the basis for making this diagnosis. And I think also really trying to understand the source of the pain and whether it's coming entirely from the back or whether we think that there is secondary nervous system involvement as well is not only helpful in trying to make the diagnosis, but helpful in trying to craft a treatment because we would treat those types of involvement separately.
Mm-hmm. And are there any pitfalls clinicians should be aware of, in your opinion, especially when it comes to things like MRI, which are increasingly central in diagnosis? How can they avoid pitfalls like, as far as maybe interpreting things like subtle findings in MRIs?
That's a really good question because first, I think you have to order the right MRI. So, the MRI of choice when we're trying to make a diagnosis of axial spondylitis is an MRI of the pelvis without contrast. So, when we use contrast, we get a really good look at the pelvic organs. But when we're trying to diagnose axial spondylitis, that's not so much what we're interested in. We actually don't want the contrast, and we want to use what's called a stir sequence so we can actually get a better look at the bone marrow. Um, I work in New York City, so I have the luxury of working with bone radiologists who can help me in interpreting this. Not everybody has that available to them, and it can get difficult because a lot of the readings you get, I think, are very dependent on the experience of either yourself, if you're reading it, or the radiologist who's reading it. And there certainly can be subtle findings that suggest sacroiliitis, which is really what we're looking here for, other than just erosions and fusions, which are late findings.